Good morning, everyone. My PhD title is Innovative Technologies in Dentistry, Exploring Digital Solutions for Enhanced Patient Care and Clinical Precision. My name is György Árpád Keskeny. I'm a PhD student and dentist at the Clinic of Prosthodontics at Semmelweis University. My vision is to shape the future dental care by making dental checkups more accurate and available for everyone. And my mission is to explore the role of digital technologies in advancing dental care and precision. I have two specific goals. One is about intraoral scanner technologies for implant impressions, and the second is about teledentistry and caries detection. My first project title is Comparing the Accuracy of Teledentistry and In-Person Dental Examination for Caries Detection. This would be a systematic review and meta-analysis. About the background, in the USA, approximately 49 million Americans live in an area where aren't enough dentists. Approximately 20% of the US adults have dental issues but delay or avoid dental treatment due to the cost or lack of access. And moreover, according to the World Health Organization, 2 billion people suffer from caries. In rural areas, many patients need to travel to see a dentist up to 60 miles, and the waiting times can be 3 months. For example, nowadays in Hungary, in 2024, 244 vacant NHS dental posts have been reported. So these areas have been without a dentist for at least 6 months, which is almost 10% of the whole NHS dental posts in Hungary. Teledentistry offers a solution for these big issues. By digital tools, smartphones, and other applications, the dental care can be improved in this area. And other benefits should also be mentioned, such as patient education, affordability, and we can cut unscheduled dental visits by almost 35% as well. And the cost comparison is very important, because an average dental visit costs near $200, while a teledentistry consultation typically costs near $80. So our clinical question is teledentistry suitable for the diagnosis of caries? Our population is always real patients seeking dental diagnosis. Our index test is some kind of teledentistry tool used for caries detection. And our reference is always traditional in-person dental examination. And regarding to the diagnostic accuracy test is about caries, and we need sensitivity and specificity. And our hypothesis is that teledentistry is not inferior compared to in-person examination for detecting caries. And my research and clinical implication is to improving accessibility to early caries detection and reducing the risk of caries progression. Here you can see my systematic search key, which was finalized in December, so about 2 months ago. And here you can see my flowchart selection. So at the beginning, I had almost 11,000 articles. And after the title and abstract selection and the full text selection, I had 23 eligible articles. And thanks to the citation chasing, which is now obligatory, I found a brand new article which was published in February this year. So thankfully, this part was very good for my systematic review and meta-analysis. And here you can see my first project progress. So I've completed the data extraction, and now we are moving to the next phases. And my second project title is Comparing Efficiency of Intraoral Scanner Technologies for Implant Impressions. This would be also a systematic review and meta-analysis. About the background, in the USA, 46 million people are completely dentaless, and 120 million citizens are missing at least one tooth. This statistic shows the importance for dental restorations, especially for implantations. Dentists always have to take impressions to do these restorations for patients whose missing teeth or those who require implantations. Accuracy is important, as inaccuracies can lead to huge problems. Up to 30% of the direct restorations may have detectable marginal gaps, potentially resulting secondary caries or restoration failure. And we can be always as accurate as our impression was. So basically, there are two kinds of impression-taking methods. The conventional one is often inconvenient, time-consuming, include more clinical steps, and may pose allergy risk due to the silicone materials used. However, we have the digital method, which is made by digital intraoral scanner devices. Based on the literature, dentists prefer to take digital impression instead of the conventional one. It needs less chair time and is more sustainable as well. In the following slide, you can see the two most popular scanners, the Trios 5, which operates with confocal laser scanning technology, and the CEREC digital intraoral scanner, which operates with triangulation technology. Based on the literature, confocal laser scanning technology has a shorter learning curve. That means that dentists can learn to use confocal laser scanning technology in a shorter time. And there's a big difference and a big problem with the triangulation technology when mapping approximal or narrow spaces, because it works by projecting a laser onto the dental surface and capturing the reflected laser light. In contrast, the confocal laser scanning technology scans the surface point by point, and it can scan the surface in real depth as well. But there's a big difference between the prices as well, because the CEREC costs near $50,000, while the Trios 5 costs near just $20,000. Due to these differences, our research focuses on comparing those two technologies in the terms of clinical efficiency, which can be described by accuracy and scanning time. Accuracy includes trueness and precision, and we always compare the STS file generated by the digital intraoral scanner devices to the highly accurate laboratory scanning data, and our secondary outcome is the scanning time. Here you can see my clinical question. Is there any difference in the accuracy and in the scanning time of intraoral scanners operating with different imaging methods? My population is always virtual models from implants. Our intervention is confocal laser scanning technology. My comparator is the triangulation technology. And I have two outcomes, the accuracy and the scanning time. The hypothesis is that confocal laser scanning technology is more efficient than the triangulation technology. And my clinical and research implication is to guide dental practitioners selecting the most affordable and efficient intraoral scanners for their practice. Here you can see my systematic search, which was finalized in November, so about 3 months ago. And here you can see my flowchart selection. At the beginning, I had about 5,000 articles. And after the duplicate removal and after the title abstract selection, I have now 108 articles. So to see the project progress report for this, that I have completed the title abstract and the full text is in progress for this second project. To sum up, I would say that for the teledentistry and caries detection, the planned submission date is this year, August. And for the second project is for the planned submission date, I would say that next year, January, is the planned submission date. And I want to end my presentation with the words from Winston Churchill: success is not final, failure is not fatal. It is the courage to continue that counts. And I want to thank you for your kind attention.
Thank you so much for your presentation. And my first question, I have only one, honestly. So my one question is related to your first topic. So you mentioned that there are teledentistry tools that are capable of identifying a caries lesion. And I would like to hear more about this process because it's just hard to imagine.
Thank you for your question. After the COVID pandemic, the teledentistry and telemedicine and the publication numbers increased, we can see. And basically, the teledentistry has not a long history. It was, I could find articles from 2009 and 10, but they weren't used smartphones on those studies because there weren't any good smartphones. They used digital single lens reflex cameras in dentists at the dental office. And in some other studies, they used intraoral camera. nowadays, in the last 5 years, we can see that most of the articles which was published, they use smartphones, especially iPhones, Google Nexus, or that's the main digital teledentistry tools. And there are two kinds of teledentistry tool usage right now for the subgrouping as well, because we can now see that it doesn't really matter who uses the teledentistry tool, whether it is used by the patient or whether it is used by the dental professional. The only thing matters that just take a photo or use the teledentistry tool, because that's how you can make the caries progression and the risk in a lower way. So basically, to simplify my answer, that smartphones nowadays, they are the most frequently used devices, and nowadays intraoral scanners can be also detected, but they are still under investigated, so we need more studies for that.
Thank you very much. Thank you, Katinka. Darius, I think you also had a question.
So, congratulations for your well-structured presentation. Regarding your first project, as you said, teledentistry is a hot topic since the COVID-19 pandemic. And I've noticed that you have a quite big number of articles you extracted the data from. And I'm just curious, is there any distribution based on the country where the studies were done?
Thank you for your question. Well, most of the studies were conducted in Australia, because this country is a special country, because in some cities or towns there aren't any health care at all, because you have to see a dentist or a medical doctor or a GP, you have to travel like 60 or 100 miles, because there is long distances, and in the desert, there is no health care at all. So that's why a triage system is very important for them. So in Australia, from Estee, for example, a lot of articles were published by him. We can see clearly that that country, and from that country we have good articles, but also India. I have articles from India, Iran, and Pakistan as well. So really, I would say that well, healthcare management is not so in a good way, where we need a real good healthcare management. I have good eligible articles from those countries.
Thank you very much, György. We have time for just one more question. Thank you.
So thank you for your presentation. It was really nice. I would like to ask, is there any available data about the patient acceptance or the actual usage of the teledentistry services?
Thank you for your question. Well, I will in the future investigate this also, because the patient acceptance is very important. I have seen and I have read articles about the patient acceptance, but there is a big heterogeneity for the how to get those patient acceptance data, because basically there are forms which were given to for the patients, and from them I can clearly see that the patients loves this kind of caries detection method. Basically, the children are the most frequently used. So they are the population. So early childhood caries and children is my main population. But also old age pensioners, old age home citizens are also very important because, for example, my newest article, which was included in the citation chasing part, it was done in Egypt and in an old age pensioner home. So basically the two main categories is the old patient, the old population, and the very young population. And they both accept it. I mean, this is not a harmful method to detect caries. And for children, it's very important that they have also dental fear and anxiety for most of the time, but that's another PhD topic.